Jornay, Concerta, Ritalin, Daytrana, are they all different names for the same thing? And how do these types of ADHD meds compare to the others? Here is a drug scientist's guide to the universe of methylphenidate. So methylphenidate is one of the first ADHD medications out there. Now what we see is that it does work decently well. So it seems like amphetamines, like Addy, might work the best for the kind of vast majority of people. But then it's kind of right there with it. It is actually incredibly effective, and it seems to be more effective than other drugs like atomoxetine. These effects can last for a while. So it seems that even after like a year and a half of using it, it is just as effective in most people. Now, there are so many types of methylphenidate. So you have like the short acting to kind of immediate release methylphenidate, and that is Ritalin. So that's kind of like the original drug. And then you have the short-acting dexmethylphenidate, and that's Focalin. Then you have all of the long-acting formulations. So you have things like long-acting Rit, and then you also have long-acting Focalin. And then you have like this osmotic oral suspension, and that's Concerta. Then you have this oral suspension that you use with a syringe, and that's Quilivant. And then finally you have this like patch that you have to remove after 9 hours, and that's Daytrana. Now you've asked me to do videos on each one of these, and I'm doing a video on all of them because they're all basically the same thing. They're all just different versions of methylphenidate depending on how long lasting the effects actually are. And so which one somebody should take depends on like when they're getting the symptoms. So if you have worse ADHD symptoms in the morning, you might want like an extended release drug that produces more of its effects, or at least half of its effects with like the first release. But if you get more of the kind of ADHD symptoms at night, you might want a drug formulation that releases more of the drug in the evening hours, so during its like second release. And this is something that you can talk about to a doctor. So they're actually like little tables that tell you when each drug is kind of being released in your system. And so that can help you based on when you see those specific symptoms. Now, as a reminder, I'm a PhD, not an MD, so I'm not giving you med advice here. This is something that you really just need to bring up with your doctor because they will know these differences. The problem is here that it's very trial and error. So you have to first start taking the drug, and then you're titrating up. So you're trying to get to the dose that you need. And then once you figure out that dose, then you need to like be like, okay, but I'm feeling good in the morning still, but I might need a little bit more in the evening. How do we tweak this? These drugs produce very fast effects in most cases. So we're talking about you start to feel the effects within 30 minutes to an hour, but it might be a little bit before you figure out what protocol of dosing actually works best. So now, how does methylphenidate work in comparison to something like an amphetamine, so something like Addy? What we see is that it has kind of similar effects, but there's this little bit of a difference. And so both drugs work by increasing dopamine and norepinephrine. But it seems like amphetamines might increase dopamine to a higher extent. So in terms of like looking at actual dopamine levels in the brains of rats, amphetamines actually seem to increase it far more than something like Rit does. That's probably because amphetamines seem to increase the actual like release of dopamine, whereas things like methylphenidates primarily actually block the transporter, so block the recycling. So instead of just making more, they just block it from being taken back into the system, meaning that it stays out in the system longer and therefore can produce more of an effect. Now, it does this in the same types of brain areas, so it's affecting things like the prefrontal cortex and the parietal areas, which are areas that we see that ADHD might produce some kind of changes in. So it is working in the same area. So like Addy versus Rit, they're doing very similar things in the brain. It just seems like Addy might be a bit more powerful. Now, methylphenidate might also increase activity in the serotonin system. We are kind of exploring this more right now, but that might explain some of the interactions that it has. So for example, we see that people shouldn't take it with other types of antidepressants that work in the serotonin system. There are also interactions with things like caffeine and some strong interactions with things like alcohol. Like alcohol increases the concentration of methylphenidate in the system, which can increase the effect of it, and this can be problematic. So similar to what's happening with blow and alcohol. And there are like weird things that occur with the specific types of drugs. So Concerta shouldn't be taken by people who've had like a gastric bypass or have some sort of GI issues. And Jornay takes about 10 hours to start, so people typically take it the night before they want to experience the effects. Now, the side effects between all of these different types of drugs are actually very similar to one another, and they do kind of differ from the different types of classes too. So in comparison to things like Addy and things like atomoxetine, we actually see that methylphenidate might be more linked to things like heart problems, which are seen with the amphetamines too, but also things like dyskinesia. So these are kind of like repetitive motor movements. And we see for things like atomoxetine, that's actually linked to more reports of things like aggression in children and adults. And Addie is most closely linked to things like psychosis, whereas you don't see that as much with RIT. Now, both self-harm and precocious puberty are more closely linked to things like methylphenidate. And precocious puberty, which is another great band name, is basically the starting of puberty before age 8 in females and age 9 in males. And we're not entirely sure about what the long-term effects of this are in children in relation to ADHD medication. Now, there's also been reports of things like trichotillomania, which is basically like plucking out hairs in your body over and over again, kind of like a compulsive desire to do so. But we haven't really looked into this much at all. And there are some weird long-term side effects too. So it's been linked with things like depression, as well as just like a decrease in the appetite, so the desire to eat. But it's also been linked to like excessive sweating, so hyperhidrosis, and to things like an increased likelihood of getting the flu and also getting acute tonsillitis. Those we have basically not studied. But one positive associated with methylphenidate is that it's like unlikely to cause an overdose. So it does have interactions with other drugs, but by itself is not actually that dangerous. There's also a question about if it's addictive. Like one of the worries that we have is that people will misuse these drugs. So like amphetamines like Addie and methylphenidate like RIT, they increase dopamine, and drugs of abuse typically increase dopamine. And yeah, we do see that people misuse it. But long-term use of things like methylphenidate did not increase the risk of using other drugs, and in fact seem to decrease the risk of both drug addiction and behavioral addictions like gambling or sex addiction, which might at least partially be based on the fact that if you're treating the symptoms of ADHD, you can be helping treat symptoms that are linked to drug addiction too, like impulsivity. And also, people might be self-medicating for ADHD by using drugs, so maybe if you're treating it, they don't have to self-medicate anymore. The reason that we have so many different types of methylphenidate is because it works. It's decently safe and it's decently effective. And yeah, it does have side effects, but so do all of the other categories of ADHD medication. And at least with these formulations, you have a variety of different options. Do you want long acting with short? Do you want something that works more in the afternoon versus the evening versus the morning? They can kind of set you up for that. So talk to your doctor if you have any more questions, but at least now you have the basics of what's going on with the methylphenidates.